Hello and welcome to Health Talks. I'm Dr. Raina Mittal, a GP and a lifestyle medicine practitioner. In today's episode of our infertility series, we'll be focusing entirely on lifestyle and infertility. I'm joined by infertility specialist Dr. Smriti Bhatta, and together we will explore how factors such as diet, exercise, stress, and daily habit can influence fertility and what practical changes couple can make to improve their chances of conceiving. Hello, Dr. Bhatta. Thank you once again for coming for the second series of podcasts.
Thank you for inviting me.
Of infertility. We are going to continue about infertility, but today I'm going to just cover the lifestyle factors affecting the infertility, which is, I think, has a major role. And we discussed that a lot for the people in the primary care. But what do you think? What is the impact of infertility and lifestyle have on to each other?
Yeah, so lifestyle plays a major role in fertility issues because anything, and there are various aspects of lifestyle which you can count into it. Obviously, we'll be going into more details.
Yeah.
But starting with your weight, what you eat, what choices you have regarding use of smoking, alcohol, recreational drugs, and whether you choose to exercise or not, all of them can have an impact and can play a role in your fertility. So that's how important it is. And optimizing your lifestyle can actually improve your chances of getting pregnant naturally through treatment, as well as it can impact the outcomes following pregnancy if you get pregnant. In terms of reducing all the adverse complications like miscarriage, giving birth early, etc.
Okay, so very often people ask us, like, when in their teens, they're young, they don't know much about it, they were not thinking about fertility at that moment of time, and they were going about eating fast foods, had all smoking, alcohol, and that's fine in their career. But now they hit 25 and 30, they are settled, they are married, and now they come up and say, okay, if I stop all sticking smoking or alcohol, giving up, will it improve or bring it back altogether, the fertility?
So to answer this question, it's slightly different in men and women.
Okay.
Now, in women, all women biologically are born with a fixed number of eggs, which is genetically determined.
That's right.
Then, over the course of their lifetime, any conditions they may have medically or their lifestyle can have an impact on that. Okay. So in females, you cannot reverse anything that's lost from your fertility potential. Okay, be it down to surgery, be it down to environment, be it down to medical condition. Okay, so therefore, for females, it's a continuous loss of eggs, which accelerates with your age anyway. And on top of that, if you have any lifestyle issues, then that can add to it.
Okay.
Plus, you cannot reverse it. Now, in men, it's slightly different because in men, the way sperm is produced, it is produced cyclically.
Right.
So it's kind of a 3-month cycle. And if a man decides to give up all the kind of lifestyle things which are impacting the sperm for a period of 3 to 6 months, then there is a potential of reversing and formation of new sperm, unless they have a condition within their testicles or medically which will not let it that reversal happen. But mostly in men, yes, you're still able to kind of regain some of it, and in the absence of any other problems linked to fertility.
It seems like very unfair, isn't it?
Yeah.
That the woman is born with a pot, and that pot is declining all the time, and then lifestyle factors has more impact on that pot, so the more decline is happening quickly.
Absolutely.
However, man can change his behavior, and their sperm quality can get better if they changes all the things which is impacting. But still, there's a hope of doing things up. But what I understand you're telling is that infertility or fertility is something people should always think around it.
Absolutely.
And it's not when they're hitting the age of 25 and 30 and want to get pregnant, but I guess the bad lifestyle can have a big impact even if they lose everything.
Absolutely. So, and that's where, in females, the fertility assessment is so crucial because nowadays the fertility care is set up in a way that only when people have a problem, they come forward. you know.
Yeah.
So they are not proactively like we are thinking about our health conditions. We do, general MOTs. We check,
Yes.
whether our heart is working okay or not. But we forget to check how our fertility is working.
That's right.
So, and because we know of the impact of age and that, it cannot be reversed in females, it is so important that the females actually are proactive and consider fertility assessment, so that anything that they may have, yes, majority may not have anything, but if you do have and age has affected it and it can be picked early, then the treatment or anything else that you need can help you better.
That's a real change, isn't it?
It is.
It's a shift on mindset.
Absolutely.
Yeah.
Absolutely. And the fertility assessment, to coming into that proactive thing is very important. And this is one thing I tell all my patients, whether they be young or whether they presented me, that consider things that to get checked early, because only when you check you will know where you are. Yes, if everything is okay, you are reassured, you know when to plan and whether it fits in with your plan. But if we do pick up early, then you may have to readjust your plans and focus on it. That's right. Family building is your aim.
Okay. What about the role of environment toxin? Because that is something that's around us. It's a part of our life. We really cannot avoid it. How is that impacting fertility?
So there have been actually very many studies on these toxins, and specifically on a class of chemicals called phthalates.
Okay.
So phthalates can be present in our food packaging, these foods we buy off the shelf from supermarkets.
Right.
So in the food packaging, they can be found in the cosmetics and the one we use where there's parabens, phthalates, etc.
Right.
And in some, occupational wear, especially in the nail products and all.
Okay.
So phthalates are, and there are other chemicals which are now classed under a category called endocrine disrupting factors.
All right.
Okay. So what they do is they basically mess with or, will not let your reproductive hormones work the way they should. And they can disrupt the activity at various levels. Okay. Right. Because in your hormones which control your reproduction, they're released from the brain, and then they have an effect on the target organ, which is the ovary or the testicle in the men. And the way and everything is down to signaling from where they're released to where they have to work. Right. So these signaling pathways are affected by those environmental toxins, which we call endocrine disrupting factors. And because of that, you will have either hormonal imbalance. In females, you'll have ovulation problems. In men, you may have low sperm count or sperm not swimming well. So therefore, it's very important to be vigilant of what you're eating. The more fresher you eat, less packaged food you eat, it's better. As well as, always checking the labels of whatever you use, in terms of cosmetics or other products. And because these are very little things, but they can have a big impact.
So I think just being mindful more when you're shopping the stuff.
Absolutely.
And that's the only way to not avoid buying those things and consuming those kind of a food.
Absolutely right.
Yeah. And what are your thoughts on about this vaping, alcohol, any recreational drug people are using a lot these days?
So that is the thing, and these all three categories have got effect in one way or the other.
Yeah.
So let's start with smoking, which is kind of the most heavily researched thing. We know its impact on the general health.
Yeah.
And if you think, any of your reproductive cells, which is the egg or the sperm, they are specialized cells, but at the end of the day, they are cells which have to then kind of, procreate. Now, the smoke or vape, they have got harmful chemicals in it, more so the smoke. And in that there are things like nicotine, tars, and other harmful chemicals which cause what we call as oxidative stress to the cells. Yeah, so along with your general body cells, the machinery of your reproductive cells, the egg and the sperm, is even more delicate. So what these harmful chemicals do it by the process of that oxidative stress will not let the egg perform to its best ability, and hence affects the quality of the egg and the sperm. Along with that, the studies have also shown that smoking, they can harm the way your ovulation happens in female. Again, in men, the swimming ability of a sperm quality of sperm. So in all manners, smoking is considered to be harmful. And therefore, this is one intervention that we always advise our couples to consider quitting, before they are trying to get pregnant themselves or through treatment.
Yeah.
One other effect of these is that these harmful chemicals, if somebody does get pregnant, then it can pass through the placenta and harm the baby. Yeah.
Right.
So anybody who smokes is at a higher risk of pregnancy loss. They're at a higher risk of birth early, as well as complications during pregnancy. Plus, if they have any associated conditions like high blood pressure, etc., again, that risk can be elevated if you're a smoker.
That's right.
Okay.
So lot of
absolutely, there's lots of these, and these are all down to the harmful chemicals the smoke has.
Yeah.
So therefore, that's one thing. Now, the other aspect of fertility is we talked about the egg quality, but again, the egg quantity as well can be reduced. So therefore, smoking is one thing which absolutely has a massive impact, and one intervention that definitely is advised. Okay. Do you want me to carry on with the alcohol?
So I think definitely a lot of people are getting aware of the smoking and they are giving up smoking, but they're moving to vaping. But as I think we don't have a much data on the vaping yet, because it is just recently started. But if I meet a client, people like that, I still tell my patient vaping is still have its own dangerous things. So yes, they can switch it over to vaping, but idea is to stop altogether.
That's
you
correct.
suggest that.
That's correct, because currently, as you said, there's limited data. We don't know, how, it was brought on as a substitute for smoking, but still some of the vapes have nicotine in it. Again, until we have more data that it's safe, it's best advises to avoid it and not go on it. Yeah. Definitely.
And again, I would think alcohol is, you can have a little now and then, but again, it all has a negative impact on infertility.
Absolutely. So alcohol, again, the evidence, obviously, there is plenty of evidence there. Now, what alcohol does is first of all, it can rob the body of essential vitamins, especially if you take it in a larger amount. And those all vitamins are important for reproduction, so that's one. And the second is it can cause absorption issues, etc., with your gut. So again, and there's a lot of calories and all that you can take in through alcohol, which again can disrupt the way you'll take in other nutrition. So there's kind of multifaceted ways in which alcohol can. However, a little bit of alcohol is considered okay, but to be mindful that there is something called fetal alcohol syndrome.
That's right.
So in which sometimes, even if you're on a very minimal level, they can have an impact on the baby. So the best advice is not to take at all. But I know, with the lifestyle and social environment we live in, it's kind of at times not possible. So very occasional alcohol would not harm unless there has been a problem with alcohol in the past, but overall advice is to avoid as far as possible.
What about the role of caffeine?
So caffeine, as you know, everybody wants to go and grab a cup of coffee in the morning.
I think it's the most common addiction at the moment, which you don't consider as addiction, but it is the most.
No, you're right. Because with caffeine, yes, again, there has been studies and it's linked to the amount of coffee you drink. So drinking coffee generally is not harmful, but it's considered that if you drink up to 200 milligram, which is 2 8-ounce cups, that's okay.
Okay. That's a
lot. Absolutely. But there is a harmful limit that's come out in some studies, which is up to 5 cups. So generally we'll say 1 or 2 cups a day, not more than that, from the fertility point of view.
I always think of that if you take more caffeine, it affects your sleep as well. And sleep has, I know it's not a direct role, but it says that indirectly it can affect infertility.
Because how it is, as you directly said, there's no causation, and again, association with sleep also is very rare. But the sleep is something that resets everything within your body, right? And that can include your reproductive hormones, which are controlling your fertility. So therefore, yes, it may have an indirect role, and it's exactly the same we can say for stress. So there's no linkage, but yes, now that association is being studied more and more.
That's
Because
right.
people do suffer from stress in the modern day-to-day life, and whether it can have an impact. So again, the little bit of link that has come through is that they of their impact on the reproductive hormones, and whether they have that potential to disrupt how the reproductive hormones are working. Because if you have hormonal imbalance, then you're likely to have ovulation and other problems.
Yes.
So in that perspective, there's kind of more research is needed in this field. But yes, early studies are kind of trying to explore that linkage more and more.
Yeah. I possibly want to touch a little bit about exercise as well, because that's a big part of the lifestyle,
Yeah,
I think.
absolutely.
So a lot of people come to us and ask how much exercise they should do, because they have read lots about it.
Yeah.
Some people do a lot of exercise is also not great. Some people do too little exercise is also not great. So what is right? What is the right to do?
Yeah, so actually, in terms of ovulation problems in females, exercise is a major incriminant if you're over exercising.
Yes.
Okay. So whenever we say, now obviously it depends upon an individual's own pattern and behavior for how much exercise they want to do.
That's
Some
right.
are more geared up towards exercising, some are less. But whenever the exercising is affecting your diet or your overall body weight and the body fat, that can have a negative impact on your fertility.
Right.
Okay, so therefore we see that those who are long distance runner, those who run ultra marathons, those who are exercising 6 times a day in the gym, 6 days a week in the gym, and it's affecting their body weight or eating pattern as a relation to that, then those are the kind of, that group can have fertility issues. Okay. Because there what happens is your fertility hormones are processed in your peripheral body fat. Okay. And the amount of fat you have controls the production of the hormone estrogen, which is one of the main hormones. Okay.
Right.
So those who have got low BMI, and again sometimes linked to over exercising, can have in less production of that estrogen. Okay. Or on the other hand, if you're kind of building up a lot of bulk of muscles with exercising, you may have more of the estrogen. So the body thinks like that as a contraception and will stop ovulation. Okay. So there can be impact both ways, with very high and very, more. So therefore, we always say moderately exercising. So moderate exercises, about 3 times a week. And a mix of kind of different kinds of exercises where you're doing some cardio, some strength training and all. But over exercising, is kind of if you're absolutely every day of the week going and doing it. So that's something we would like to avoid.
Okay. Interestingly, there, because of the gym, there's another question comes to my mind is, these men, when they go for all exercises and after that they go and sit in a sauna or a hot room for a long time. And obviously we know the temperature of testicles are so different than the temperature of the inner body. How does that impact, to tell our viewers? Because I think a lot men go and sit in sauna for a long time and they do that every day after they exercise. So what is right? How much they should do?
Yeah, that's the thing, that as you rightly said, the testicles are outside your body for a reason, because the temperature of the testicles has to be kept lower for effective sperm production. So if you're engaging in any activity where the testicles are likely to be heated up, whether it be sauna, whether it be very hot baths, whether it be prolonged cycling, wearing tight undergarments, all that, it can have the ability to raise the testicular temperature, and that can have an actually impact on sperm production and quality. Okay.
What can we do about it, or how much taking sauna is right?
No, you can take sauna, but don't overuse it. I don't think sitting 10 minutes in a sauna would have it. But if you're like going in every day for 30 to 45 minutes in a sauna, of course it will affect you. Okay. So that's one of the things you just need to be mindful of. It's not that you need to stop it totally, but again, always we say that everything has to be in proportion. Any overuse, can have a deleterious effect.
Okay, I think this is all I could think of the lifestyle questions, but do you have any tip for our viewers to do one lifestyle changes what that could be.
Yeah, sure. There's one other thing I think we haven't touched, which is your cell phones. Your use of
yes.
cell, because it's omnipresent now.
That's right.
Everybody has a cell phone in their
That's
pocket.
right.
So again, cellular radiation has been linked to some, DNA damage in the men, and that can have the effect on the sperm. So we advise obviously to not keep it directly in the pockets for very long, or avoid radiations. So keep it a bit away from you.
That's right.
So again, all these things are very early research, but it's just being mindful of the use of it, and especially if you're facing fertility issues.
Okay.
So coming on to your last tip for the viewers. So I think if you need to put it in one line, it is to stay fit, move more, eat healthy, and relax.
Basically, that covers all, isn't it?
Absolutely. So that's, I think, anyways, a general mantra.
That's right.
The same goes for fertility.
That's right. So thank you so much for that. That's a quick session, and we talk about the lifestyle. We probably do another session on infertility, and we cover more on nutrition and that.
Absolutely.
In
I
the
think
next
that would be
session.
interesting, because there's a lot again, and that and diet is everybody's daily.
Yes.
So we do need to see what are the things that we know from studies and all. So I'll be happy to come and speak to
thank you so much for that.
Thank you.
We'll end this session today here. We have covered a lot, from the role of stress and sleep to the impact of diet, exercise, and even environmental toxin. I hope you're walking away with a better understanding of what's within your control and where to start making gentle, sustainable changes. And remember, this isn't about being perfect. It's about being informed and supported. Lifestyle is just one piece of fertility puzzle, but it's an incredibly powerful one. If you find this helpful, please do share it with someone who might be getting benefit. And don't forget to subscribe so you don't miss the next episode. In part 3 of Infertility series, we'll talk about infertility and the role of nutrition. Until then, take care of yourself, and thank you for being here. Bye-bye.